Good morning and happy Friday. Happy Friday. This is Dr. Yonette with another episode of Baby Talk. And today I want to talk about the older baby, the 1 year olds. So you are not going to be considering your child a baby at this point, but we can call him an infant or a toddler because he is or she is busy just finding their way around your house. And I know at this point your heart is in your hands. So let's talk. Let's talk. How have you been doing? Have you been taking care of yourself as you take care of your baby? What does your 18 months old baby do? What should he or she be doing? Since you've been journaling, you've been noticing all the achievements that your child has been having. And I want you to be very, very keen on this because sometimes parents wait until late. I don't want to say too late. I was going to say too late. Until late before they acknowledge the delays that their child might be having. I was speaking with a parent just recently, and she was sharing how it's only now that her child is older and she's able to compare the child with other children in a classroom that she is seeing the delays that her child has been experiencing. So be vigilant. Look out and see where your child needs to be at each step of the developmental milestone. So let's talk about the 1 year old child, and let's start with the social emotional milestone. Your child at 1 year old or 18 months old, before he hits that 2 month period, 2 year period or 24-month period, should be able to move away from you, but look to make sure that you are close by. You know, he is exploring, but he's making sure that you are not out of sight. He or she should be able to point to something interesting. They see a fruit on the table and he or she wants it and he points to it. Or he sees a book and he points to that book, or a toy and he points to that toy. You know, at 18 months old, your child should be able to put his or her hand out for you to wash them. So you've started that one hand washing routine, and they know what they have to do to put their hands out for you to add the soap and for you to start with the washing process. He or she can also pick up a book and look at a few pages. And I wanted to ask you to, engage him so that he looks at more than a few pages. But the basic is that he or she should look at a few pages and then should be available to participate in dressing. And by that I mean they should be able to put their arms out for you to get the shirt over the head and on the body. So, what does your child do in terms of language? Now, you have known that your child has been saying mama and dada for a while. But at 18 months old, you want to look out to see that your child has at least 3 words, 3 to 5 words, I would say, that your child says in addition to mama and dada. And this information that I'm sharing with you today comes from the CDC. Your child should be able to follow a one-step direction without you pointing, without doing any gestures. For example, if you say, give me your bottle, your child should be able to give you the bottle. Okay, now how is your child learning and thinking and problem solving? When your child is at this stage, he or she should be able to copy whatever chores you are doing. For example, if you are in the kitchen sweeping, your child should be able to pick up his or her little broom and sweep as well. And then your child should be able to participate or play with simple toys or play in a simple way, like pushing a toy car, like riding on a toy car. So he or she is playing. Let's look at movement. What kinds of movements does your child do at this age? Okay, so your child is walking? Fantastic. But look to see that your child is walking without holding on to anyone or anything. If your child still needs to hold on at 18 months old, you should look into that a little closer. When you give your child a pencil or a marker or a crayon, your child should be scribbling, should be able to scribble. This is the age when you tell the child, oh, don't scribble on the walls. But as an occupational therapist, I am particularly concerned that your child is able to scribble. Give him or her a writing tool and let him scribble. You know, for some kids, their hand control or their grasp is not developed yet, but some kids it's just like an automatic development and they just hold on to that writing tool and they start to scribble. So 50% of children experience that, and so you want to encourage scribbling. Now, your child at this age, from a physical perspective, should be able to drink from a cup without a lid. There may be some spills from time to time, but your child should have that eye-hand coordination to be able to use a cup and drink from a cup, to feed him or herself using her fingers or his fingers, and then to try to use a spoon. That control isn't yet there, but at least they're trying to scoop up with the spoon. And then you are looking to see that your child is able to climb on and off the couch without your help. I am going to spend a little time here really trying to get your attention in terms of how you speak to your child, because this is going to set the foundation for how your child interprets his or her world. I want you to use positive words, and give more attention to the behaviors that you want. For example, when your child goes to bed, when he or she is told, then you can say, I like the way you went to bed nicely tonight. Give more attention. I like the way you asked for your cup today. Give more attention to the positive behaviors that you're looking for. And you want to ignore or pretend when your child is demonstrating behaviors. Pretend you didn't notice when your child is demonstrating behaviors that are not appropriate. You want to encourage your child in pretend play. Like, for example, you set up a tea party with your child and have tea or playing, or set up the child's stuffed animals and give him or her a spoon so that he can feed the child, and be there to take turns back and forth with your child so that the experience is rewarding. And then finally, you want to help your child to learn about others' feelings and about a positive way to interact. If your child does something that that makes you sad, when he sees it, then you say, he looks sad, or I am sad. And you can also role play using the stuffed animals that your child may have. You can say the stuffed animal looks sad, or your stuffed animal is happy. Engage your child in pretend play. So today I'm talking about the 1-year-old or the 18-month-old who is developing nicely. You are continuing to journal and to keep an eye on your child's development. You're continuing to enjoy these experiences. And as you take care of baby, you are also taking care of you. This is Dr. Yonette, thanking you for joining me today and looking forward to seeing you tomorrow as we do Read Time with Baby. Have a fabulous Friday.